Doctors of Reddit, what's the stupidest thing you've had to explain to a patient? It's really sad when it happens, but when I have to explain to people that their limbs aren't growing back. I'm a medical student in my last year of clinical rotations. Me, so your blood glucose and A1C are off the charts. We need to talk about your diet. Patient, I cut down on what I eat. I'm eating a lot lighter now, just like the doctor told me to do last time. Me, describe what you would eat on a typical day. Patient, well, for breakfast I eat 2 donuts and I might have 2 more for a snack after that. And me, so you're diabetic, you really shouldn't be eating donuts. Patient, but they don't weigh much. They are really light. I was eating much heavier foods. Patient thought eating lighter meant by actual weight. I don't even know sometimes. Explaining body parts to people. Them, but what is it doctor? Me, that's your blank. It's supposed to be their example. A woman was convinced her cervix was a foreign body in her vagina. Edit. Taste buds was another common one. I agree with everyone who said sex education is poor in the States. I would extend that to health education in general. Many people have very little understanding of how their insides work, where things are, and what they do. I feel it's part of my job to explain and educate. Nurse here. I explained to a patient prison inmate that if you toast white bread, it doesn't become whole wheat, even though it is brown. My gynecologist told me that one of her patients was trying to get pregnant, so she prescribed her Clomid to help her. Couple months later, and she still wasn't pregnant. My gyno asked her if her partner was fertile, and she told her that she hadn't been having sex. The lady thought the pills alone could impregnate her. That having sex gets you pregnant. It was a 20-plus-year-old woman that couldn't grasp the idea that sex leads to pregnancy. She thought that in order for a man and a woman to have children, they needed to be married first and then have a baby. That sex was just an act unrelated to it. Then again, we are talking about a small rural community in the middle of freaking nowhere, Mexico. Community health nurse here had to explain to a pregnant patient that smoking cigarettes to keep her baby's weight down is in fact a not good method of ensuring a less difficult labor/delivery. Nurse here. Patient concerned about 2 bumps on the upper part of her abdomen same size and feeling on each side. Ribs mom. Those are your ribs. Doctor here. Had a patient convinced his alternative treatment was better than the standard treatment with proven 90% response rate. Why? He read that 2 people in Mexico cured their cancer that way. His thoughts on my evidence-based approach? Yeah, but there were only 3,000 patients in that trial, and it could have been a fluke. Why have standard treatment when you could be buying snake oil from abroad? Psychologist here. A very anxious woman was consuming 3 or 4 pots of coffee a day as she'd been told it would calm her down. If only all problems were this easy to fix. This is exactly my experience working in psych. Patients come in complaining of anxiety and insomnia and want Ambien and Ativan. Come to find that they are a student drinking 6 Red Bulls a day. It's amazing the number of people who don't even consider the cause-effect relationship caffeine has on their symptoms. Not a doctor, but a nurse here. I had a 16-year-old girl present with abdominal discomfort and nausea. I was assessing her, and she hadn't had her period for about 6 to 8 weeks. I asked her if she was sexually active, and she said yes. I asked her about birth control, and she said no, because she couldn't get pregnant. I then inquired as to what medical condition she had that prevented her from getting pregnant. What? I don't have any conditions. I just can't get pregnant. Quote unfreaking quote. Guess who was pregnant? Dumb 16-year-old girl that couldn't get pregnant. I was dumbfounded by her stupidity. On a positive note, the boyfriend stuck with her, and I saw her again a few years later. She had graduated HS and was applying for colleges. Medical student here. One time a young girl came and said she wanted to have a baby with this guy, so he would finally fall in love with her. Had a long chat about expressing emotions verbally rather than just physically. Edit. Just wanted to point out that 3 of her best friends that were about to enter grade 11 had babies of their own. My mother was a substitute teacher for about 8 years. The stories she told me had me shaking my head so hard. Many of them were about 7th graders that openly bragged about their pregnancies and how the baby daddies had to love and marry them because of it. Nurse here. Work at a vac clinic, so all our patients had served in the military. A 27-year-old came in asking for a refill of her birth control that she's been on for over 10 years, as well as a consult to gynecology because she was afraid she's infertile since she hasn't ever been pregnant. So we had to explain that the purpose of birth control was so she doesn't get pregnant, and she decided she didn't need infertility testing. I'm a nurse. Had to tell a girl in my nursing class that an ring wasn't meant to be worn on your wrist. Nurse here. I once had a Marine patient who came in complaining of pain during sex. After some investigating, I had to explain to him that no, the condom is not supposed fit over his dick and balls. His words. It's a toss-up between you are gaining weight and feeling tired, not because you are deficient in a mystery vitamin, but because you down 6+ alcoholic drinks per day, and if you have anal sex with your boyfriend and he puts his penis inside your vagina right after, yes, you will probably get a bladder infection.
N.
Not a doctor, but a corpsman, Navy's version of a medic. I had to teach a grown man how to bathe himself. He was from Higgville, middle of nowhere, and just flat out didn't know better. It was pretty sad, honestly. Veterinarian here. I had to amputate a dog's leg as a last resort. The owner asked me how long it'd take to grow back. I had to explain that it won't. Another owner was concerned about a large growth on her hamster. Had to explain that the growth was actually the critter's testicles. Had to explain to another owner why feeding her horse sausages was making him ill. And to another couple why they couldn't put their cat on a vegan diet. I've had to explain that one to a lot of owners. It's getting ridiculous. Not a doctor, but during a medical clinic we were providing to Afghans, I had to explain to a 30Y/0 man that anal sex doesn't produce babies, so he shouldn't beat his wife for not getting pregnant if he was just doing her in the butt. Hooray for non-existent education systems. I work in a busy inner city. I had a patient call an ambulance once because he had a nosebleed. Now if you have a nosebleed that won't stop, go to the before you lose too much blood. When I say it won't stop, I mean after putting continuous pressure on your nose for 10 minutes without stopping to check if it stopped bleeding. When I asked the patient to describe it, he says he blew his nose and it bled for less than a minute. He called an ambulance because he wasn't sure what to do after the nosebleed stopped. One of the fastest discharges I've ever done. I'm a respiratory therapist, not a doctor. I work in NICU and the doc were trying to explain to a dad why he couldn't take his baby home. Baby was premature and intubated. Baby was on our most advanced ventilator and high levels of oxygen. After I explained that to him, just after the doctor explained the same thing, Dad asked what did they do before oxygen. So I told him they died, sir. And that shut him up. Had a patient in the hospital who had an anchored urinary catheter and was getting 4th TPN yellow colored 4th fluid full of vitamins and minerals. I was asked why we were putting the patient's urine back into them through the 4th. EMT here. I've had to explain to many people that if one of their buddies overdoses on heroin, the recommended treatment is not inserting ice cubes up the rectum to wake them up. Have had to tell that to multiple people. Funny story from back when I was a first year medical student. We were doing human anatomy, and around the 2nd semester they brought 2 or 3 entire human bodies to study. A friend of mine caught my attention while she was looking at the crotch area of male corpse and was palpating the corpse's limp dick. Went near her and asked what was she looking for. She said, "I'm looking for the bone." I was laughing 5 days later. Medical social worker here. Had to explain to a newly paraplegic patient that he would not be getting the use in his legs back. He was upset with his physical therapists for strengthening his arms and stated, "Why the hell are they focusing on my arms? It's my legs that need fixing." Well, sir, there is no fix in your legs and they're trying to teach you how to live independently using your arms. Not a doctor, sorry, but I had to explain to my best friend in high school that you don't have to wear a tampon when you're not on your period. She thought you wear one for the rest of your life. I'm the dumb one in this case. I was on an IV for the first time. It was the middle of the night and my fourth bag was empty. I watched in horror as the air bubble in my IV line got bigger and bigger. Sure, it was going to go into my arm and kill me Final Destination style. Hit the call button a million times for the nurses to rush in and have to explain to my hysterical crying as that it would stop before it reached my arm. I'm a nurse and have had many PTS in a similar situation. I always feel so bad cause that must be horrifying. I ended up looking it up because often people would see a tiny bubble and freak and you would need pretty much the entire length of tubing filled with air pushed into you to cause an air embolism. Physical therapy student. I tried to explain to a guy how 1 you can't smoke in a hospital and 2 if you were going to you shouldn't do it while on oxygen because it is flammable. I came back the next day and he had burns across his face. Not a doctor, but worked in an ER. One busy night this one old guy screamed at nurses saying he had waited 6 hours and demanded the doctor and staff to look at this weird growth on his foot. So the nurse took off his shoe and looked at his foot. It was a plantar wart. So the nurse, thinking he doesn't know what it is, and asks him what he thinks it is. And deadpans, "It's a plantar wart, you dumb beach. Are you gonna get rid of it for me?" The nurse promptly asked security to escort him out for being unruly and said, "Go to the clinic across the street. It's a freaking plantar wart." Guy thought his plantar wart was an emergency and wanted everyone to be at his beck and call. Edit. Spelling. My so is a dentist. Almost daily she has ridiculous patients. Today she treated a 12-year-old boy who was visiting his grandparents for summer vacation. One of his upper molars had abscessed, and he had a literal hole in the roof of his mouth from the infection. She had a difficult time getting the grandparents to understand that he needs to have the tooth pulled and not just give him another round of antibiotics. Almost weekly she has people tell her, "Oh, I don't need another antibiotic prescription. I still have some left over from the last time." Cue educational session of how antibiotics work. Every now and then she'll get the super religious nut jobs that don't know why we're here since we just pray for healing anyways. The most recent one was where the wife needed several extractions, but they didn't believe it and said they'd just go home to pray for a miracle instead. The husband was bragging how everybody on his street knows of all his miracles. He's a local hero. Lastly, she needs to explain sex ed to patients more than you might imagine. Mouths are a popular place to put other people's junk, and the amount of people that don't realize cold sores and herpes are the same thing astonishes us. Until I met her I never really considered it, but there are plenty of people in the world that do not brush their teeth. Not as in, they passed out on the couch and didn't brush, but they cannot remember the last time they used a toothbrush. I've learned a lot from her myself. Edit, punctuation and more about the miracle man. Had a patient come into emergency at 3 am the other night. She was freaking out because she had discovered some nodules under her tongue and then began to feel unwell. I had to point out that these were just the little lumps where the saliva gets excreted from the salivary glands. She buried her face in her hands and left swiftly. Another life saved.